When the asthma diagnosis first came, the physician that I was working with, their first line of defense was to try oral corticosteroids. Unfortunately, that seemed to be the only line of defense for about 4 years. I was continuously on oral corticosteroids. I was told they would work wonderfully to control the symptoms, they would help with the inflammation, I would feel so much better, and all of that was true, but it wasn't explained to me that, that they're detrimental, that it suppresses your immune system and that it can have long-term effects. I definitely think I wouldn't have been as eager to take the steroids if I had realized the long-term, damaging effects. It definitely in the short term affected my appetite, affected my sleep. I even started to get they call it a moon face, where, the weight gain was distributed in that way. So I definitely think that that's something patients should be made aware of before they start taking that medication. I've been told by my eye doctor that I have signs of cataracts. I'll be 50 tomorrow, and so it's early, and he said that that's from long-term steroid use. In addition, when I had my daughter, which was 11 years ago, they had to give me IV steroids prior to delivery because they were afraid of how my immune system would respond. Other than that, I seem to have returned to normal. I don't have any other, thank gosh, lasting effects. But again, definitely things that I didn't take into account. So about 4 or 5 years into my asthma diagnosis, my pulmonologist decided that we would try biologics. And the first biologic, it worked great at controlling the asthma, and it worked for several years. And I didn't realize that I may at some point have to change medications. I didn't realize that the medication may stop working at some point. And I found that out when that's what happened. I started to have asthma flare-ups that required prednisone use. And at that point, my physician recommended we try another biologic. We tried that. It worked wonderfully for the asthma. However, it did not help control the sinusitis. So at that point, we made a switch to the third biologic, which is what I'm currently on. I've been on it for about 5 or 6 months. And this biologic has worked wonderfully to combat both the asthma and the sinusitis. When I was told that I needed sinus surgery to remove the polyps, it wasn't explained to me that the potential for recurrence was there. I thought that I would just have a single surgery, remove the polyps, and that would eliminate the issue. That wasn't the case. I had to have 2 subsequent surgeries for a total of 3 to remove the polyps. And I now realize that the potential for another surgery is there. I think it's very important for physicians when they're working with patients that have asthma and chronic sinusitis that there be transparency. I think a physician needs to let their patient know that we're going to try a course of treatment. This may work, this may not work. This may work for a short time, and then you may find that we need to switch. I definitely think that for me, I would have had a more realistic expectation of my course of treatment. I think it was a surprise to me when the first biologic plateaued, and I wasn't finding the same response that I was getting before. So I think transparency is definitely important. And on the flip side, I think it's important that patients report back to their physician what they are experiencing. Don't feel like you're complaining. You need to let someone know how you're feeling and what symptoms you're experiencing so that they can be addressed.